Welcome back to another episode of Demystifying Self-Publishing. I'm your host, Alyssa, and today's guest is Dr. Mark Tyndall, physician and longtime advocate for harm reduction. In his new book, Vaping, he takes on one of the most polarizing public health debates of our time. Can vaping actually save lives? In this conversation, we'll explore his journey writing and self-publishing the book and why he believes we need a radically different approach to addiction and public health. This is a conversation that challenges assumptions, invites nuance, and asks us to rethink what harm reduction really means. Welcome to the podcast.
Thank you.
I appreciate you being here, and I'm excited to jump into the book, the process behind it, and the waves that it has been making, as well as, I'm sure, perhaps a little bit of controversy because of the topic at hand. So I would love for us to kick things off by first chatting about what actually sparked your interest in writing this book and why now.
Okay, thank you very much. So I start off the book by saying I'm an accidental vaping advocate. So, 5 years ago, this wasn't in my career plans, but my career has really been in HIV prevention. And that took me to a lot of work with people who are using injecting drugs. And then I got involved in needle exchanges and supervised injection sites and giving people safe supply. All sort of classic harm reduction topics. And I was a researcher and clinician for many years. And then about 2012, I read about vaping as a substitute for smoking. And I realized at the time I was following all these HIV positive people who were using drugs and looking for health outcomes, mostly bad outcomes with HIV and bad outcomes with their drug use. And it turns out that most of the bad outcomes that I was recording were smoking related. And in this population particularly, smoking was pretty much ubiquitous. So if you were using street drugs, you could pretty much guarantee that those people would also be smoking cigarettes and using nicotine. So I had a community advisory group at the time. And I was working in Ottawa then. I introduced vaping to them and they liked it. As an aside, that community group advisory started out with 8 members. I lost 3 of those members in the first few months due to smoking related problems. So one person was diagnosed with lung cancer, one person had a heart attack, and one person was confined to their rooms on oxygen because of severe COPD. So it was clear to me that something needed to be done. It was one thing to keep people alive with their HIV infection and their drug use, but I wasn't doing anything to address their nicotine addiction and their smoking. So That's when it occurred to me that this is an ideal solution for people who are smoking cigarettes, and that I could provide them with a much safer option. So that's when it clicked for me. So that's now 10 or 12 years ago. And I wrote an op-ed in the Ottawa Citizen at that time saying that, I could see in the next decade that, these safer products would replace cigarettes. And little did I predict that we're further away now than we were 12 years ago as far as getting people switched over.
Right. And what do you think has vastly contributed to that? Because I know that there is a lot of, I would say, fear-mongering perhaps happening through the media, in society. What do you think is the reason that we haven't seen the progress that you anticipated?
Yeah, well, I try to address some of this in my book and try to bust some of the myths. I mean, early on when these were introduced, they were called e-cigarettes, and even the term is sort of generated this idea that they were just like cigarettes. So, and the media kind of ran with that they look like cigarettes and you're still inhaling some vapor. It must be bad for you, and it looks bad, so it must be like cigarettes. And nobody really dug deeper to find out that hardly any of the damaging toxins and poisons that were present in combustible cigarettes were there in vape. So it was a far safer product. We knew that from the very beginning. Tobacco control advocates, people in charge of those policies, have really practiced prohibition and abstinence-based policies. So the only real option for people who smoke was to quit. After decades of working with that, we know that people find it very difficult to quit. Our go-to therapy has been nicotine patches. There's been lots of research, and they work maybe 5 to 7% of the time that people try them. So they're not very effective.
Right.
So, but the tobacco control had become so entrenched in this abstinence-based policy that they viewed vaping as just another nuisance, basically, and that it would just cause more problems. And they created all kinds of concerns that we were addicting a whole new generation of people to nicotine, and we were wiping out all the progress we'd made with smoking eradication. And then there was a huge focus on youth vaping, and that took on a life of its own. And the media was full of reports of high school kids vaping, and became a huge problem. And that was really amplified when obviously there was a uptick in vaping when it was new and novel things. It became a real sensation in social media. And in 2017 in Canada, it emerged that 27% of high school students had tried vaping. So that became a huge headline and became a moral panic that kids were vaping. The truth is that it peaked in 2018, the vaping rates among high school students are now quite a lot lower. There's very little evidence that those kids gone on to smoking. Smoking rates in North America among youth are at historical lows, like 1%. So it hasn't started a new smoking epidemic. And most kids who try things like cannabis and beer and other things that we try and discourage young people from doing, they don't become habits. They type risky behaviors that young people take, but it's not as though we've created a whole new generation of nicotine addicts. So
Right.
the focus on youth vaping, misinformation about how dangerous vaping was, just the tobacco control groups that were so used to abstinence based that they did not recognize what a breakthrough vaping and safer nicotine was.
At what point, so you said that you wrote an op-ed. At what point did you realize that this could be something bigger and sit down and begin the process of writing this book?
Yeah, I mean, a lot of time passed between the op-ed, and I continued to speak about it. I was definitely on the outside with my public health colleagues, and who were quite bought into the idea that vaping should be eliminated, and there was a blight on society. And so I've been pushing back on that for over a decade now. But I guess about 3 years ago, I decided that, I had written enough little articles and op-eds and done enough interviews that I should put some of that on paper and turn it into a book that, people could turn to. And when I looked around at what's been written about vaping, it's essentially all negative. So from a public health or medical profession or pediatricians, whoever jumped on the vaping bandwagon, it's all anti-vaping. And most of what I read was just not true. Like, it wasn't based on evidence or science. It was based on fear. The messaging that we're giving to youth, especially, but general public on the whole, was that this was a huge conspiracy by tobacco companies to, they saw the cigarettes might run out and they needed another product. And they made up all kinds of hysterical stories about this. And it became really a push against big tobacco companies who, ironically, didn't invent vaping and didn't really want safer. They were quite happy with their cigarettes. This was a disruptive technology for cigarette companies. And some of them, they've had to kind of jump on board and start to produce some of their own safer nicotine. But in Canada, for instance, 80% of vaping products are not big tobacco. There are all kinds of different companies who are doing this. So it's not a conspiracy by big tobacco, and big tobacco companies are adjusting because they've had to, but they're not interested in getting this done quickly. They want to transition slowly, I think. So It's up to us to push them and say, okay, you're part of the solution now, but you have to make some very aggressive plans to phase out cigarettes and get people safer products.
And I know you had talked about the fact that There, of course, in the media and through, the public lens even, there has been so much misinformation surrounding vaping, surrounding, a lot of the myths that are out there when it comes to vaping. Was there then a pivotal moment that convinced you that, you had done all of these op-eds and all of these articles and immersed yourself so much within the space that a book needed to be written and it needed to get into the hands of the public and people within the public health industry?
Yeah, I think most kind of first time authors, or I've written a lot of scientific papers, but never wrote a book that could be accessible to the more general public. And so for me, it was almost a personal challenge. Whether a lot of books got sold or whether people read it was kind of secondary. I mean, obviously that I'd want that, but I actually stepped away from my job. I was the head of the BC Center for Disease Control, which kind of was a large administrative job. And I actually moved to Bali, Indonesia for 2 years with my family. So I really stepped away from my medical and research work for a couple of years, and writing a book seemed like a cool thing to do when I had all this time that I was in control of. Some kind of therapy. It was fun to write and to try to my challenge was to not make it a kind of a scientific diatribe, but try to weave in some of my own personal experiences. And it's almost a little bit part autobiographical. I try to use examples of, personal experiences with working with people with addictions to show how harm reduction works. So the process of writing was enjoyable. Sometimes I ran into walls, but for the most part, it was my own sort of growth and achievement of trying to write a book.
It seems to be that there's a common trend among authors who, some of them are looking to educate, some are looking to leave a legacy, some have it kind of on their bucket list. I mean, there are many different motivating factors, I think, for those that do choose to sit down and write. But then I think it goes one step further when you make the decision to then publish. So where did you decide that, I now have written this book and it's not enough for me to have done that. I really want to get it out there. Did the idea of shopping it around to traditional publishers cross your mind, or was it more of a challenge because of the topic?
Yeah, I didn't shop it around. I didn't consider that. I actually, did a bit of research into self-publishing, and from what I understood and anybody I talked to, being a first-time author, pretty challenging to get a traditional publisher to work with you and to do it. Right from the beginning, I was kind of discouraged that that's probably not going to be a workable path for you. I contacted or was in touch with Tellwell long before I finished the book. So right from the beginning, that's what I decided to do. And actually making some commitment to Tellwell financially, or like it was a motivator to get it done. So I think it was very useful to get that done and have somebody I could bounce things off of and to try and guide me along the process right from the beginnings. When I signed up to do this with Tellwell, I just written some very early drafts, basically. So most of the writing was done after I had committed to getting it published, and probably that was a good motivation that I had
Yeah,
to get done.
absolutely. That's a unique approach for sure, but it is interesting to hear about the different ways that, we are motivated or the things that can help hold us accountable. You have primarily had your experience with writing be a little bit more scientific based as opposed to this type of story, as you mentioned, that you kind of wove in some of those autobiographical elements and more of your own personal experiences. What did you find that process to be like? And were there any challenges that you faced while navigating writing the book?
Yeah, I mean, through my career, I had a lot of anecdotes that I could share. I probably, wrote two or three times as many anecdotes that got in than were published. So a lot of things that I would describe and write, and then you'd have self-doubts. Well, who cares about who would be interested in that? So I think that, yeah, part of the process of getting it out there is that you have to talk yourself into anybody cares. If you do it just because you enjoy writing and I wanted to get my thoughts all in one place is one thing, but then the next step, well, I want to get this promoted and I want other people to read it. It's kind of a leap over the fence to do that. I mean, I feel very strongly about this topic. I think that, without, obviously overstating it, I think this is the public health revolution or potential revolution of my generation. Like we have cigarettes, 1.3 billion people smoke cigarettes. All of those people will suffer from their cigarette use, and 50% will die directly from smoking. Like it's a massive public health issue in the world, and we have a way to deal with it. So this is vaping is, I'm trying to argue in the book, vaping is not just a little bit safer. It's like way, way safer. There's no evidence. So, to date, after 15 years of quite widespread use, that there's any cancer, any heart disease, any lung disease. I mean, it's a very safe product that we could revolutionize the world's healthcare system. So it's a massive, massive topic. We have an opportunity to actually eliminate combustible tobacco, I think, or at least what if half of the 1.3 billion people stop smoking? Like that would have dramatic impacts in the world. I was just in Kenya talking to a group of harm reduction people from Africa, and I lived in Asia for those 2 years and dealt with a lot of people in tobacco control in Asia. I mean, these are countries that could have a dramatic impact on their healthcare system if they got rid of cigarettes. So in some ways, this is like a massive breakthrough. And I'm just one small voice trying to tell people, wait, you're all wrong about this. This is really something we should be embracing and promoting, and we could really use this to improve people's lives.
I want to chat a little bit about what you just mentioned, which is the different cultures that you have been immersed in. You mentioned, having been in Kenya, having been in Asia. I know you've done a lot of traveling outside of that as well, a lot of speaking outside of that as well. What has the reception been like in these different cultures versus more Western society?
Yeah, that's a fascinating question because the book is really Canada or maybe North America centric. These are the issues that we have. This is the people that are smoking in Canada. It's really an equity issue. So people from more marginalized communities and people with less income are more likely to smoke. And so that we have to have specific programs to kind of help promote it within those communities. In Bali, the smoking rates among men are 75%. So everybody you see walking on the street has a cigarette in their mouth. It's like so entrenched in the culture. So the approach to that is different than it would be in Canada. In Africa, I lived in Kenya for 4 years in the 1990s. So I'm fairly familiar with that society. And people, for the most part, are too poor to buy any nicotine products. So, and as the people come out of poverty in these countries, it's a very young population. So there's high likelihood that smoking rates will actually increase. So while they're decreasing in Western societies, in Africa and Asia, they're actually increasing. So the approach needs to be much different. In Africa, it's not culturally entrenched. So there's a opportunity to really bypass the whole cigarette culture in those countries and switch to safer nicotine right from the get-go. In Asia, where it's so entrenched, it's a different approach where in some Asian countries, they banned vaping altogether. So I can't imagine a country like Thailand and Vietnam with extremely high smoking rates, and we have a product that's way safer for them. And somehow these countries with WHO influence have banned them. Like it's irrational. It's absolutely ludicrous that you're seeing somebody who's smoking a pack a day and could offer them a vape and reduce their risk by 90%, and we're somehow telling them they can't. It's really irrational to me. But in answer to your question, I do think there's cultural differences around the world, and the basic premise is not so much get everybody to vape, but get everybody off cigarettes and using safer nicotine products, whether it's pouches or whether it's vape or whether it's heat not burn products. We need to offer a range of things to people, but the basic goal is to get them off the most dangerous thing, which is combustible cigarettes.
Not to sound like too much of a conspiracy theorist, you are a small voice in this huge landscape of different industry professionals. There's definitely a burden on our healthcare system. So with something that could alleviate potentially a huge strain there, it seems like it would be a no-brainer. Is there conversation or thought around, big pharmaceutical companies benefiting from people continuing to smoke cigarettes? Hey listeners, if you've been enjoying the show, I'd love it if you'd take a moment to leave a quick review. It helps more writers discover the podcast and lets us know what you'd like to see more of. Your words matter on the page and in the reviews. Thanks for supporting our community.
Yeah, no, it does sound like a conspiracy theory, but if you talk to people, nobody will admit that, and maybe they don't really think that, but there's so much apathy and inertia in the system. So we built a system, our healthcare system is basically built around smoking. It's all these big cardiac units we have, all the lung cancer centers we have,
right?
The stroke centers, COPD, we've really have structured a lot of our, at least emergent care around cigarette-related diseases. And people can't really see a way out of that. We technically, we could eliminate 90% of lung cancers if people didn't smoke. I mean,
Right.
That's a lot of resources put into that. And the other partial inertia is because of taxation, and the governments benefit a lot from taxes from these products. And there's inertia there too. So, and although we really think about health, our strain on our healthcare system and how we can help that, the impact of people stopping cigarette smoking probably wouldn't be seen for 5 or 10 years. I think we'd see a major impact, but in our short political cycles, governments don't see the benefits they won't see the benefits right away. If there was no new smokers from today, we'd still need all these services for decades to come because all these people are still smoking. Vaping and safer nicotine products allows us to really cut that back. So if we know the other amazing thing about cigarettes, although they're so damaging to people, if you stop within 15 to 20 years of your stopping, your life expectancy becomes almost the same as if you had never smoked. So there is some forgiveness there. So giving the message to people who feel by now they're going to smoke for the rest of their lives, and it's no sense quitting. It's not right. No matter how late in the stage you quit smoking, it's a benefit to your health for sure.
Right.
And so people need to know that any time's a good time to switch and quit. And it's like we now have a cure for smoking, and we should treat it like that. This is if somebody had high blood pressure and went into their doctor's office, and all their doctor told them was, look, you got to get your blood pressure down. I don't know how you're going to do it, but it's going to kill you, and not do anything, not offer them any medication. We think that's malpractice. But we do that with smokers. People come in and they're smoking, and their doctor tells them, well, you got to quit smoking. It's going to kill you. A year after year, they still smoke, and they've never offered them a safer product. I think that's unethical. We have an obligation to offer people the truth that this is a much safer way to get your nicotine. Nicotine's not your problem. It's the combustible cigarettes you're using. And as healthcare professionals, we should offer people the best alternative. And the best alternative is abstinence, quitting. But we know that that doesn't work for a lot of people. And we need to offer people. And I get this from my harm reduction thing, like, so people were sharing needles and getting HIV. The best thing they could do is stop using needles or stop using drugs. I know that's an impractical demand for people at that particular time. So when I saw them in the clinic, I said, my goal for you is for you not to get HIV. Here's a box of needles. Don't use a clean needle and you won't get HIV. When I was working in Africa during the HIV pandemic and people came in and I could offer them nothing but a condom. And I said, yeah, I know you're going to continue to have sex, but if you don't want to get HIV, I want you to use a condom. I mean, it's just practical. And for me, cigarettes are the same thing. If you don't want to get lung cancer, switch to vaping. So these are, to me, it's just so obvious and practical solution for people. And we've got bogged down in this idea that we're addicting a new generation and it's big tobacco and all these kind of side issues that really are not, in the whole scheme of things, are very small print, and our focus really needs to be on eliminating smoking.
So where does the industry go from here? What kind of regulation would potentially strike a balance between protecting youth and supporting adults who are trying to quit smoking, or just making vaping a more acceptable, socially acceptable option for people?
Well, I mean, I think writing a book is kind of giving people some information and busting the myths. So when over the last few years, I've talked to so many people about vaping, and 90% are misinformed, just have the wrong information. They just talk about popcorn lung and things that don't even exist. So so part of it is just getting people the information that they need, I think. And then as far as policy goes, every policy we make as far as accessibility and taxation and age, everything should always favor safer products. It makes sense. You shouldn't be able to go into a gas station and buy cigarettes and not be able to buy vapes. They should be, at the beginning, they should be side by side, and vapes should be taxed at a much lower level because they're a much safer product, and to incentivize people to try them and switch. And, the other controversy about flavoring, people like flavors. So 90% of the vapes sold in stores are flavored. And so this idea that flavors only exist for kids and people trying to quit smoking should stick to tobacco, the worst flavor, because they want to get rid of that flavor. I mean, it's sort of counterintuitive. So we want to promote a safer product and give people information. We want to tell kids that it's better not to vape, that it's being addicted to nicotine is expensive and inconvenient. Like, we just need to give the facts, but it's not going to kill you. So and those kind of upfront messages to kids is important. I think we should have age restrictions. We should have information. So I'm not advocating flooding the high schools with vape, but that we need to prioritize, keep our eye on the goal of eliminating combustible cigarettes. And the best way to get kids away from tobacco is to get their parents away from tobacco. So it works very positive. If we can get adults to switch to vaping, then kids are less likely to smoke cigarettes. And they may try vaping, but they try a lot of things, and it's not a reason to stop it. If we took that approach with alcohol, we'd ban alcohol for everybody because it's really bad for kids, and we want to keep it out of kids' hands, so we're going to ban it for everybody. And probably that wouldn't go over very well. So.
Right, absolutely. Was there a part of writing this book, whether intellectually or emotionally, that you found to be particularly difficult?
Not really. I mean, I rewrote certain sections. So some days I felt in more of a ranting mode and it would sound too preachy and ranty. And so, keeping a balance, I wanted to support all my statements with some science. There's, the book's well referenced, but not overly referenced. So it's not like a textbook kind of thing. So I tried not to make statements that may appear controversial without substantiating them with evidence and studies and things. So I made a point of making it readable and accessible, but still having it based in sort of science. Not sort of science, but based on science and the evidence.
Right.
So that was the biggest struggle, or the biggest challenge, I guess, to keep it a rational thing. I mean, when I talk to you, I could sound like I'm just going ranting on because I'm so convinced of the value of this. But I realize that there's very divergent views of this, and I'm on the other side of the fence. Basically, most of my public health colleagues are not supportive of what I'm writing about.
Right.
Have a different approach, so I'm aware of that, and I try to substantiate what I say with the evidence that I know.
So you've written the book at this point. You have traveled around. You've spoken with harm reduction committees and teams and governing bodies. What is next for you in your advocacy journey? Is it continuing along this specific direction of vaping? Are there other things that you're interested in exploring and pursuing? What does that look like?
Yeah, I mean, maybe we could talk after you give me some counseling. I don't know. I'm sort of, I have enough, since the book came out in June, I have a bunch of invitations, and I've done a number of podcasts, and been to a few meetings, and I have some coming up in the fall. So that'll keep me going for the next few months. And after that, I'm not sure. I mean, I retired from my old job, so I'd be okay with doing yoga and golf in my days and hanging out with my family. So I'm not sure. I think I'm quite passionate about it, and I think I want to continue to pursue it. But what that will look like, I'm not sure. And the book is like a thick business card, basically. So it opens up opportunities for me, and I just want to make sure I take the opportunities that I'm happy with, and I'm excited about doing, and that are serving my purpose. And I'm in a kind of interest. I realize it's a nice position to be in. I don't really have to work. I don't, I have a house to live in, and I'm okay. So I could retire, I guess. But if opportunities pop up that I find intriguing and challenging and interesting around this topic, then I think I'll probably end up doing something.
I like what you said about your book acting as a business card, because I do find that there are a lot of opportunities that tend to stem from the efforts of publishing a book that then kind of spiral into what we refer to as authorpreneurs, people who can take the book and do a speaking engagement and sell the book. The book kind of supports the speaking engagement topic, or vice versa, depending on the book and the genre. So I think that it's interesting that you phrased it that way, and I'm excited to see what's next for you.
Thank you.
And I just have one more segment here. It's called The Plot Thickens. It's a user-generated question segment. So for those listening, please be sure to give us a follow at Tellwell Publishing on Instagram. We post to our stories asking for people to submit questions for our guests on the podcast. And the question that came in is, there are often strict regulations around advertising and promoting when it comes to health-related topics. Have you encountered any issues with this, and what strategies have you found to be the most effective in promoting this book?
Yeah, I mean, as far as promoting the book, I think I can say what I want to say. It's a book, but one of the major challenges for safer nicotine products and vaping in particular is it falls under some tobacco control, and it's very difficult to promote it. So I'm all for restricting advertising in tobacco. I'm all fine with that, but somehow vaping and safer products should be handled differently on that. So right now in Canada, it's actually illegal to say that vaping is safer than cigarettes, which is ridiculous. Like, there's all kinds of evidence that that's possible. The Health Canada website states right away that it's much safer than smoking cigarettes, but the industry is not allowed to say that, which is, I just think, incongruous with what, transparency. I mean, why would you lie to the public? It doesn't make any. So some of the so from my book standpoint, I think I can say what I want, but there are real issues if we want to position safer products as more accessible than cigarettes, that there are a lot of advertising hurdles to get over.
Well, thank you so much for joining me for this conversation. I've really enjoyed it, and I think it'll be enlightening for our audience to listen to as well. For those who are listening, please be sure to subscribe on Apple Podcasts, Spotify, or wherever you listen, or follow us on YouTube to watch the full video. We'll see you in the next one. Bye. Thinking about self-publishing but not sure where to start? That's where Tellwell Publishing comes in. We offer assisted self-publishing services to help you bring your book to life your way. From editing and design to marketing and distribution, Tellwell's team works with you to create a book you'll be proud of while you keep creative control. From Lamar Jackson and Cindy Cherry to Kaya Usher and Rita Kakati Shah, Tellwell has helped thousands of authors publish their book with confidence. Visit tellwellpublishing.com to start your journey.